Hi, my name is Jessica Smith,
And I'm Claire Levitt.
and this is our home health visit. We went to go see a 76-year-old man with a blockage on the left side of his heart that was actually repaired. We were able to walk around in their home and talk to him and his wife. The description of his home, they have 3 sets of stairs, which is something that we were concerned about, into the house, basement, second floor, and deck. But both wife and the husband seem to be able to get up and down the stairs easily. There are multiple rugs placed around the home with nonstick mats under them. However, the corners still stuck out in some places, and I noticed that that could be a risk for falls, so we educated the patient about making sure that those nonstick mats came all the way to the end so there were no risk for falls. There is good lighting all around the house in all the rooms. They do have a security system as well. Doorknobs are easily accessible. They just got the bathroom redone for a safer entrance into and out of the shower and bathtub. The home environment, the yard, or their house is in a country setting with multiple trees around the yard. And it's not necessarily a neighborhood. They do have neighbors, but they're about a half a mile away. But they do have family that live near them in Auburn as well, so we weren't too concerned about that. He does like to do woodworking, and so we were very concerned about having any sort of accidents involving that. So we educated him about making sure that his wife or that someone was at home or close around, and that weren't going to be gone very long just in case something were to happen. And then they have fireplaces, but they do not use them. So the overall safety of the house was pretty good, and we were not too concerned except for those 2 minor things. He manages his health condition pretty well. He keeps up to date with his health checks. His wife ensures that as well. So his eye exam, his auditory exam, because he does have a hearing aid. He does see his physician and his cardiac doctor as well on a regular basis. He is not sedentary. He's very active. However, he does not do the cardiac exercises that are recommended for him. But he seems overall in good health. So we weren't too concerned about that, but we did encourage him to continue to do his cardiac rehabilitation. He does have a gym membership, and we encouraged him to do aerobic exercise for 30 minutes and mild resistance training as well for a total of 40 minutes 5 days a week. Patient cannot drive at night because he cannot see very well. So his wife usually drives, but they usually do not travel past dark. And we did encourage the patient to visit a physical therapist for his balance issues as well.
So, as we said earlier, the patient did have a blockage on the left side of his heart, and it was a chronic condition that led to his aorta malfunctioning. So, he ended up going into open heart surgery for it. He was placed on bypass and had a calf valve replaced, replaces aortic valve. So, he's on a number of medications due to that surgery. He's been placed on aspirin as blood thinner, and he's also on simvastatin to control his high blood pressure. He is on omeprazole for a history of GERD, and then he's also on some medications for anxiety and depression that include aproprazole, bupropion, escitalopram, and that's all. And then he's also on Centracell for as a osteoporosis preventative medication. So we talked to the patient about some resources he has in his community to help with his heart and also just in his elder age. He told us he uses a community gym that has a focus on the elder population and doing exercises for that. He also goes to a church support group. That he attends regularly. And then finally, we did some research and found near him is the East Alabama Services for the Elderly, which just really focuses on keeping the elderly independent and living a healthy lifestyle. They provide transportation, nutrition, doctor referrals, as well as recreation and personal care for the patient. And so we just talked to him about that a little bit, and he showed some interest in that, so we thought that could be a positive resource for the patient.
And that's all.
Thank you.